HealthEd is Australia's leading provider of quality clinical education for doctors and other healthcare professionals. This episode has been made available on Spotify and Apple Podcasts. For free access to the full library of podcasts and to claim CPD for listening, visit healthed.com.au or download the HealthEd app.
I will be speaking to Professor Sally Ferguson and Dr. Prerna Varma on sleep health and shift work. Professor Ferguson, tell us about yourself.
Thank you, David. I am the director of the Appleton Institute at CQ University, and I'm based at the Adelaide campus. And my area of research for the last 25 plus years has been sleep health, but with a focus on shift work and fatigue risk management.
Thank you, Sally. And Dr. Varma, tell us about yourself.
Thanks, David, for having us. And I'm Prerna Varma. I am a research fellow at the Turner Institute for Brain and Mental Health at Monash University, so based in Melbourne. So the past couple of years, I've been working in the field of circadian misalignment. So essentially what happens when your internal body clock is mismatched to the external environment. So that's my area of work. So shift work, circadian rhythm disorders, general sleep health and mental health. Yeah.
We're looking at sleep health and shift work. And maybe I might get one of you to start with and the other to probably just add to. Tell us as GPs, again, the reason why it's important for us to know about shift work, sleep health, the impact it has on the individual and to our society. Shall we just start, first of all, with you, Sally?
Sure, thanks, David. So shift work, by definition, means work that happens outside of the traditional 9 to 5, perhaps 8 to 6 these days, Monday to Friday cycle. And so various definitions that we use, but one is any work that happens outside of that time. Some people say any work that displaces sleep from our normal sleep time. Mm-hmm. And so people who are working shift work need to be awake during the night hours when they would normally be sleeping, and to try and sleep during the daytime hours when they would normally be awake. Mm-hmm. So this challenges both their sleep system, they don't get enough sleep, and it also challenges their waking function because with not enough sleep and trying to function in the nighttime hours, performance can be impaired. That's one part of it. Over the longer term, and Prerna can add to this, over the longer term, we're understanding now that the constant shifting caused by shift work of our circadian cycles is contributing to longer term health impacts. Over to you, Prerna.
Yeah, so just what Sally mentioned, it's like shift work is really anytime you deviate from your standard work hours. And what it looks like right now is it's sort of happening more often. So about 15% of Australian workforce is in shift work, but that seems to be increasing in trend with sort of COVID and people working all hours of the day, but also with our demand for essential services. So whether it's in healthcare, in emergency services, etc. So that has obviously increased. And why we need to really talk about this is because the impacts that can have on us essentially. So we know that humans by nature have a diurnal pattern, if I'm saying the word correctly. So there's more activity during the day. There's less activity during the night. And that's sort of when you deviate from that pattern, whether it's in form of sort of working during the night or working at hours that you might be sleeping, otherwise can have serious health effects. One of which that Sally mentioned is obviously on your sleep, but also other consequences in terms of sort of higher risk for depression, higher risk for developing cardiometabolic diseases, such as diabetes or hypertension. So there's really a host of things, serious consequences really, that can happen when you're working in shift work. Obviously, I don't want to scare people into saying that, but yeah, there are some serious consequences there.
I am concerned about, of course, depression, and the occupations you mentioned really are very critical occupations in our healthcare sector. And in fact, they need to be functioning well. I'm wondering, is there any research done, not just on the impact of depression, but on more serious consequences such as suicides?
There is some
And Sally, you might be able to point out some more recent literature. From what I know, there is some nascent research on this, particularly from other countries. So there's some research from US, from South Korea, from what I remember, that there is a greater risk of suicidal ideation or thoughts of suicide in individuals who have been involved in shift work for a really long time, particularly if they do night shifts. That doesn't necessarily mean that every shift worker who does night shifts would experience those symptoms. But there is a higher risk than what you would expect in general population, at least.
Again, Prerna, we're not here to frighten anyone, but I think it's important for all of us GPs to understand, if you like, the longer and bigger impacts that these workers who really keep us going, actually, subject themselves to. Sally, do you have any comments to make about the long-term issues faced by health shift workers?
Yeah, just adding to Prerna's comments there, I think it's also, we are seeing adverse mental health outcomes in certain occupations, and it's in occupations where the workers are also experiencing trauma as part of their work. And so paramedics, firefighters, healthcare professionals, particularly in hospitals and emergency rooms. And so it's a bit difficult to pull apart the trauma from the shift work, but it certainly is the case that those two things, trauma and sleep and circadian disruption, do interact. And so I guess that's something else to take account of. And other long-term health things to be thinking about, Prerna mentioned cardiometabolic disease and issues. And so we think that that arises from the misalignment of eating patterns, because shift workers are eating at night when their body is not programmed to be processing food. And then they're at an additional disadvantage because sleep deprivation and circadian misalignment increases cravings for the less healthy foods, the high carb, high sugar, high fat foods. And then some work from, various groups, but shout out to the UniSA team, Jill Dorian and co, who did some qualitative work and showed that the access to food for shift workers, particularly on site, if you're, for example, in a hospital, what's available to eat is also a factor. So they're all things that are feeding, feeding into the cardiometabolic issues.
What does shift work eventually do to our natural circadian rhythm?
I think that's an interesting question, David, because each shift disrupts the system acutely. We don't necessarily have great data yet on what happens to the circadian system longitudinally. Work from Monash actually and others are showing that the circadian rhythm, so if you picture a sine curve, it flattens less amplitude, which across time in shift workers and across blocks of shifts. And we think that has implications for the way all of the body's systems work. But in terms of long-term, what it does to the circadian system, I think probably I think about it more as regular disruptions that happen every time people are doing a block of shifts. Would you agree with that, Prerna? Anything to add?
Yeah, I think that's a really good point. It's like with shift work, it's almost like the regular disruption that you see that potentially goes long-term, but whether that has a more sort of longitudinal, pinpointed effect that we can see, we probably still need more research on it. But we do know that on a regular basis, when you work different kinds of shifts, your circadian system does get disrupted. So that's there, yeah.
I'm just going to linger on one more issue, which of course had been very current for all of us. What does it do to our immune system?
Again, fairly new research, David, but yes, we can see that inadequate sleep, so not getting enough sleep, as well as sleep and circadian disruption, does have impacts on immune function. So we seem to be more susceptible to picking up bugs, and illness can be a bit longer. Yes. Right. There's probably some stuff from Monash's work during COVID as well, is there, Prerna?
There is. I think I'm not particularly sure whether that was in shift workers in particular, but there is growing evidence in general that inadequate sleep is related to worse immune function. So again, what Sally mentioned, like picking up more bugs, lower
In terms of effect of vaccines as well, there's a lower uptake of not uptake, but can't think of the right word here. But your response to vaccine or your response to medication sort of declines as well because of inadequate sleep. But also it's really a confluence of factors, I would say. So when you're working shifts, what Sally mentioned about diet and sort of craving more carbohydrate rich food. So Megan Crowther, who is one of our colleagues, looked at longitudinal data on shift workers. So especially these are the people that have just sort of started going into shift work and noticed how their eating patterns changed. And one of the key things that she found was that there was more carbohydrate rich intake, even though the overall calories were reduced. So that's sort of that effect that it has on diet, it has on the circadian system, but also your social and personal life. I think that combines to have an impact on the immune system, and particularly something that GPs could take into account when talking to individuals who are involved in shift work.
No, but what I'm seeing now, because it's really given us a really good understanding that there's really not a system that is not being impacted by shift work. And the impact all seems to be not minor, they seem to be quite significant. Now, having said that, and you've already mentioned a list of the people who do work shift work, and they are such essential workers for all of us, what should a GP do, or how can we help a patient who is already in shift work or about to commence shift work?
Usually from some of the research that has been coming out across Australia is that usually people see GPs, if they're doing shift work, they usually go to GP because they have a sleep disturbance that's affecting their functioning. So whether it's in form of fatigue during when they're working, or whether it's in form of sort of lower alertness or their mood symptoms. So I guess the first thing that GPs could consider doing is, especially if they're seeing someone who's new to shift work, still adapting, is understanding and communicating the risks effectively. So really explaining to them what shift work entails, what sort of strategies they can use. So things like whether they need to look after their sleep, whether they need to pick up shifts that offer them more consistency, etc. So I think that would be the first key thing, but also providing them some of the right resources that they can use to help with their sleep. So, and I might be going completely wrong, but Sally, there's more recent research on sleep hygiene practices for shift workers? I'm not sure if that's published at the moment or not.
Not quite, still under review.
Still under review, but that would come up. So those kinds of resources in terms of like sleep hygiene practices that people can use. There's also GPs could also provide people with resources from Sleep Health Foundation, which is a key not-for-profit sleep health awareness organization. I'll send you some resources for that. And that has some services that shift workers can use and how they can sort of tailor their routines around their work is another thing that can potentially help. But Sally, you have more experience. You probably know a lot more on where GPs can support.
Oh, I think you've covered things pretty well there, Prerna. I would say that one of the things that new to shift work individuals, one of the best things that we can, if it's best bits of information we can give them, is just to understand what to expect, and the fact that they will be, they will struggle potentially to sleep during the day, and they will struggle to stay alert and awake during the night, at least for the first few shifts. And it certainly will depend on a few things: their individual chronotype, whether they are owls or larks, their domestic and social situation. So understanding and planning with their house, whoever lives in the house with them, times for sleep, and prioritizing periods of time where the house is quiet, as quiet as it can be, so that they can maximize the chance of getting sleep. And then I guess the general tips that Prerna's hinted at there, the sleep hygiene stuff, general tips about looking after your sleep, whatever time of day you're trying to do it, a sleep routine, relaxation, keep the technology out of the bedroom or at least away from sleep. Don't stress as much as you can. If you're not sleeping, do something relaxing to wind down, those sorts of things.
Is there a difference between those who work, if you like, shift work that moves every few days and then have a break versus those who are pretty much on a fixed schedule?
I've been answering this question for 25 years, David, and it still is the same answer. It absolutely depends on the individual, their circumstance. On the surface, you would think that perhaps people doing fixed night shifts, for example, if you only did night shifts and you did, 4 in a row, and then you were off and then you for 4 nights and then you did 4 in a row, that might be better. It depends what you're determining as better, what you're measuring. It still is going to be a battle for sleep. You still are going to be sleeping against your body clock. You might get into a routine such that you and your house gets used to the patterns and are better at supporting. But particularly in Australia, every time we see morning light, then our internal clock gets reset. So we don't adjust our internal clocks to night shifts if we are seeing morning light, because that's the most important signal. So I think that adaptation to shift work, it's a really interesting word to use. And one of our team here, a PhD team, is having a look at adaptation from the various different sort of perspectives. Adaptation to a single block of shifts, adaptation across the work span, how your whole career, adaptation on a given night, where you might have a cup of coffee early, figure out that actually your bad time is 3 a.m, so that's where you need to be extra careful. There's no perfect shift work pattern, otherwise every shift working organisation would be working it. It's about optimising for the work and the worker and the workplace.
Thank you. Sounded it's really good. But I'm just also wondering, because you mentioned how the body clock resets when we see morning light. Does that open up the avenue for light therapy? And where does the use of melatonin sit with regard to this?
I might defer to the melatonin bit to you, but definitely the light stuff. So at Monash, we have colleagues, Dr. Tracy Sletton and Dr. Linda Shen, who are particularly looking at not just how light affects your adaptation, whether you want to call that adaptation to shift schedules or a particular shift, but also how light can be used to improve your adaptation to sleep, let's just say. So how can we effectively use light? And one of the things that they're finding is that it's a very individualized, almost case-by-case basis. So each individual would have variation in how they adapt to their shifts. They would have variations to their circadian rhythms, let's just say, but also variations in how they respond to light. So they're finding that light therapy does have a potential use in shift workers, both from improving their sleep to managing their fatigue during the shift, but it has to be very case-by-case, individualized basis. So it's not really a one-size-fits-all solution.
This episode is one of hundreds of informative and free clinical podcasts from Health Ed. Access the entire library through the Health Ed app for healthcare professionals, which you can download today from the App Store.
I look forward to more research in that area, Prerna, because it seems like if given the right sorts of algorithm or tools, maybe GPs may be able to help to individualize therapy for patients in the future with light. Sally, what about melatonin?
So melatonin can be used as a soporific, but it only works for the people that it works for. That research has been around for a while, and we haven't really learned much more in the last 10 years, I don't think. There are melatonin agonists which do similar things. And yes, you could, in theory, use it to shift your clock, but it would depend on how many night shifts you're doing in a row. And then also, as Prerna's hinted at, you would need to be avoiding light at the right times as well as taking the melatonin. So I think that for the people it works for, use as a soporific to help sleep during the day when they get home in the morning, probably yes, but beyond that, not sure.
You both did mention how GPs have a role in giving information to what they can expect. Where can GPs get such information from?
Yeah, thanks, David. The Prerna's hinted at this as well. The Sleep Health Foundation and also the Australasian Sleep Association both those websites have stacks of great fact sheets, useful resources there for individuals, for shift workers and also day workers, as well as for GPs and other health professionals. So yeah, lots of resources there that we're happy to pass on.
I wonder if either of you may have comments on patients who try to put themselves to sleep with the use of alcohol, some recreational drugs. And on the other hand, those who may actually use some of the stimulating drugs. How does it affect shift work in their function?
Alcohol. So what we know about alcohol is that it is often a part of people's wind down routine, and it, of course, is a relaxant and a soporific, but we definitely know it interferes with the quality of sleep. So it does change sleep architecture. So even if you get to sleep quicker with a glass or two of something, invariably your sleep will not be as good a quality. Recreational drugs, less research on that I'm happy to talk about. And stimulants, I think probably stimulants will usually be used during a shift or to get people home, the commute home. Legal ones, over-the-counter ones, I would support the use of, for example, caffeine as a legal and widely used stimulant. Certainly support the use of caffeine as a alertness management strategy. But with caffeine and any other stimulants, you need to be careful how close you are taking them to your planned bedtime, of course.
Sally, just as a brief yardstick, how far away from bedtime should we consume the last cup of coffee?
I don't have a cup of coffee after 3 p.m. So I'm my time's passed. My coffee for the day is done. But again, it's a really individual thing, David. So tolerance levels, time of day that you're drinking it even will impact how effective it is. And if you are driving home at 6 a.m., for example, after a 12-hour night shift, then you might want it to be peak effective at that, during that drive. Whereas you might be aiming to go to bed at 8 o'clock. So when I'm talking to shift workers about that sort of strategy, it's a bit of a trial and error and figure out what works best for them. Would you add anything to that, Prerna?
Yeah, no, Sally, I think that's a really good point about sort of it again is very individualized in the sense that what we might say to a day worker may not be applicable for a night shift worker. So usually you would recommend someone not to have caffeine about 6 to 8 hours before they go to bed. But as a night shift worker, you probably need that alertness while you're traveling from work back home. There is some recent research which has examined the use of caffeine in defense. And one of the suggestions, which again has to be trial and error, has to be researched further, but one of the suggestions that came out was use of lower doses of caffeine rather than like a strong cup of coffee or something else that has caffeine in it. So spacing out caffeine dosage throughout the night shift, just so that you have enough alertness while you're driving back home, but you haven't consumed too much caffeine that then interferes with your sleep, would be great. Yeah.
What about the use of sleeping agents, hypnotics? Do doctors prescribe them? Should we use them? If so, when?
Yes, doctors do prescribe them. And I think probably the research shows that it would be the default response to a shift worker who is struggling with alertness and sleep, either or both. It might, now again, as I've said, David, I'm not a clinician. It's probably something that should be talked about with somebody who's struggling with their sleep, and it might be a short-term trial to see if they can get over a hump or some bad habits that have crept into managing their sleep, but should be followed up quite quickly, I would think, such that if it's a more chronic issue, it can be dealt with through a sleep specialist or a sleep clinic.
I agree. I think one of the key things with shift work population is perhaps, and that probably goes on to anyone who experiences other a disorder such as insomnia and is a day worker as well, is you probably want to implement behavioral techniques first before perhaps going for hypnotics. And I say that as someone who's not a clinician. So, but yeah, so I would be more inclined to sort of evaluate what their general sleep routines are, what sort of shifts they're doing, where they can change their bedtimes or their routines if needed, where they can negotiate with their employers about their shifts. And if that is not working, and if, as Sally mentioned, if it's a hump that they need to get over with, that's when you perhaps evaluate the risk and benefits of prescribing hypnotics and get them over it quickly as well.
I knew you were both not clinicians, but I couldn't help ask that question because it is indeed the likely default response, and we need to think about that. I would like to ask both of you about the value of exercise and meditation.
So yes, exercise, good for health generally. For a long time, we have known that exercise is good for physical health, learning more and more now about the value of exercise for mental health as well. And so exercise can mean, daily walking up to, high intensity, gym or sport or whatever it is. There is a strong positive relationship between sleep and exercise. Sleep is good for exercise. Exercise is good for sleep. We used to say don't exercise too close to bedtime. There is a little bit of research just coming out that suggests it might not actually be how close, but it's how intense, because exercise can raise core body temperature, and core body temperature is linked to sleep. So I think the default position is exercise good for sleep.
There isn't a lot of research on meditation in shift workers in particular, but there is definitely some research on general use of meditation. So it could be a great way to wind down. Some of the research that I have done recently is going and talking to shift workers and what sort of tools they use. And it sounds like meditation is the key way for them to wind down, especially in professions that have quite a lot of operational demands and stress, where you might have trouble sort of going to sleep. Take it with a grain of salt though. So meditation doesn't necessarily work for everyone. And in cases where Sally sort of mentioned this earlier, where individuals might experience trauma or might be involved in jobs that involve some sort of trauma, you kind of have to weigh whether meditation might work for you, because there's some research around meditation and its use in PTSD, or meditation and its use in traumatic experiences where it might elevate your stress a little bit. So perhaps take that with that grain of salt and see if that works for you. I would say go ahead and try it. If it works, good. If it doesn't, try other sources. And as Sally mentioned as well, with exercise, definitely a good way to improve your sleep, as long as it's not too intense before your bedtime. But also it could be one of those things that you keep consistently in your routine, and it could be that thing that brings everything together while your shift work and other things are inconsistent. So yeah.
I just wonder whether both of you would like to summarize some of the key messages to our listeners. Maybe I can start with you, Sally.
So key messages are, I think, talk about life patterns and how they fit with the shift work, and understand, I suppose, the things that the reasons that sleep might be difficult, and what the flow-on effects are from getting inadequate sleep. And I guess that the conversation about the fact that shift work will challenge sleep, and learning some strategies, like we've talked about, trial and error for both sleep management and alertness management, a trial and error to figure out their own what works best for them as an individual is, yes, that would be my advice.
Thank you. What about you, Prerna?
I think I would have the same advice as Sally in terms of if you do get someone who's working in shift work, perhaps the best thing would be trial and error and looking at it by a case-by-case basis, because you're going to see such biological variations and individual variations in how people respond to working in shifts. So perhaps talking with them about what sort of lifestyle changes they can expect if they're just starting shift work, what sort of changes in sleep or alertness they can expect as they start. And if they're already experienced, perhaps working with them and identifying which of those three areas, so whether it's lifestyle, sleep, or alertness management, or all three of them that they need to work on. And then providing them advice would be the best idea, I guess.
Thank you. I wonder whether we've missed anything else.
I guess one thing I would add, David, is that shift work is not right for everybody. I think that some people are quite well suited to certain shifts, I think, whether that be their physiology or their social and domestic circumstance. And then some people are just not terribly well designed for shift work at all. I'm one of those people. I'm very much a morning person. Night shifts, I did a few when I was younger. I wasn't great at them then, and I'd be terrible at them now, 30 years later. So I think that that's probably another thing to talk about with patients, is that it might actually just not be good for you. Now, of course, not everyone can just find another job, but it's certainly something to add to the list of things to talk about.
I'm just wondering if those sorts of questions, are you a night owl? Are there members of your family or household cooperative in working around your shift work, past history of depression? These sorts of questions that can help, if you like, doctors to administer to patients, so we can see how much impact it might have and therefore counsel them appropriately. Do such resources exist?
I want to say yes and no. So no, in the sense that there's no systematic resource that exists at the moment where, and correct me, Sally, if I'm wrong, but nothing systematic that exists, which can be sort of that tick off or a checklist that you can do and then say, oh, you work for these shifts better versus the other. But some of the research that I have been privileged to be working on, as well as recently published research by one of my colleagues, Dr. Jade Murray, looks at that individualization of like what shifts might work for you versus what sort of sleep patterns might work for you, etc., based on your lifestyle. And I think that's the path that we are going from here, at least in terms of research. So maybe a couple of years from now, we'll have that sort of checklist that people could, like GPs can tick off and then provide, I guess, much personalized suggestions in terms of this is what you need to do. These are the shifts that you may want to pick. These are the best times for you to sleep. This is how you can use light or melatonin, etc. So we're definitely going down that path for sure.
I can't tell you how excited I am, Prerna, because all I'm hearing is how individualized every single intervention seems to be. It's almost like there's nothing we can tell any particular doctor about any particular patient. It's almost like a trial and error with each one. So having something that is a little bit more prescriptive so we can actually follow a guide may actually be incredibly helpful.
We're working on it, David.
Love it. And thank you for joining us and giving us your time.
Thank you so much.
Prerna, as those research becomes available, reach out to us because I'm just so excited.
I will share that paper with you so that you can
Fantastic.
have it. Thank you so much.
Bye-bye.
Right.
Thank you.
Bye.
Thank you for listening. Visit healthed.com.au to create a free account and claim CPD for podcasts like this and access a record of your learning. Subscribe to the show on Spotify or Apple Podcasts for weekly episodes on a range of clinical areas relevant to your ongoing practice.